Hi, Dr. Ken Pinnell here, coming to you from Pinnell Chiropractic, your Cranberry Township, North Pittsburgh Chiropractor. This evening, I'd like to go over some exercises that we recommend for our patients who come in experiencing lower back pain. And one of the things that's really important when you're doing exercises for the lower back is to make sure that you encompass all of the muscles that move the trunk. And one of the first that people think of when they want to strengthen their abdominal region is to do what we call crunches or sit-ups, which exercise what are called the rectus abdominis muscles. But you also have muscles that are there to laterally bend and rotate the trunk, which are called our oblique muscles. And then you have what are called the lumbar extensor muscles for bending backwards. So the best way to go about strengthening your core is to make sure you do an exercise that kind of targets all of those specific areas. Now, the one thing I would recommend if you're going to do these exercises, because we either get on the floor for this evening, I'm going to be demonstrating them here on the table. If by chance you're a patient that has trouble getting up off of the floor, you can go ahead and lay down on your bed, make it easier to get up and down. But the other thing I would recommend is to make sure you put some comfortable clothes on. These exercises do involve a lot of movement, and if you have on skinny jeans, tight pants, tight-fitting clothing, it might restrict motion and kind of compromise the effectiveness of the exercises. So the first one that we recommend is targeted for the lumbar extensors. And what you want to do is you want to get down on the floor or on your bed, lying on your stomach in what we call the prone position. And you want to get onto your elbows and just kind of extend the back upwards. Hold that for a few seconds. Let it relax. Extend up again, and you'll feel those muscles in your back fire, and that's the sensation that you want to get. You want to hold that for about 3 to 5 seconds. Let it relax. And you want to try to get about 10 to 12 repetitions with this specific exercise. Now, obviously, if you're doing them and you start to feel discomfort in your back or you start to experience pain, stop. If you're unsure whether or not you're capable of performing these exercises, certainly consult the appropriate healthcare professional to make sure that's okay to do that. Now, the next exercise that we're going to do, we're going to get on to the back. The next 3 exercises are done in the supine position, lying on your back. And you're going to have the knees bent, and this is called a pelvic tilt exercise, good for working the rectus abdominis muscle. And you want to just get the sensation that you're pushing your back down into the table. You're kind of rotating the top of the hips down this way. So you bend the hips down, let that relax. Force the back down into the table, let that relax, and you want to hold that for about 3 to 5 seconds again, and you want to do that about 10 to 12 repetitions. Talk to my patients about imagining your hips are on a swivel where they turn this way. You just want to feel the top of the pelvis drop straight down into the table. Hold that for about 3 to 5 seconds. The next exercise really works on what are called the internal and external oblique muscles, as I said, which rotate the spine or bend sideways. In this one, on the floor or on the bed, you're going to have your arms out to the side for stabilization. And then you're just going to get the sense that you're rolling those legs over, and you'll feel that activate those oblique muscles. Hold that for 3 to 5 seconds. Come over the other way. Hold that for about 3 to 5 seconds. And that's 1 repetition. Right and left or left and right is 1 repetition. You want to try to do that about 10 to 12 repetitions. Once again, if you get to repetition 5 or 6 and you're starting to feel pain, don't push that, and you'll really feel that, as I said, work those external and internal oblique muscles. The final exercise is really not so much there for strengthening, as it's just a good stretch throughout the lower back and the hip region, what are called the hip flexor muscles. We call it the single knee to chest. And you just want to get the hands in front of the knee and just kind of get a nice passive stretch, pulling that knee towards the chest. Hold that for about 3 to 5 seconds. Let the leg and hip relax. Pull that back up. And you want to try to do that about 10 to 12 repetitions. And then you'd repeat the same thing on the other side. Hold that for a few seconds, let it relax. Pull that back up. And same thing, try to do that about 10 or 12 repetitions, but stop if you're experiencing pain. So if you do those on a regular basis, we see a lot of our patients that really find that that gives them some good relief. If they're having a day where they're stiff or sore, you get down on the floor or on the bed and do those exercises. Not only great for strengthening those areas, but it can also help to relieve some pain on a temporary basis. But we certainly don't want exercise to replace the importance of seeking proper medical or chiropractic care. So hopefully you find some good results with doing these exercises. If you have any questions or comments, feel free to leave those below. Subscribe to our YouTube channel. Also, like us on Facebook. We'll be posting some of these videos on there. For more information about our office, you can find us on the web at www.pinnellcc.com. For now, once again, this is Dr. Ken Pinnell, your Cranberry Township, North Pittsburgh chiropractor. Until we talk again, thanks so much.